More than 160 people in South Carolina are under quarantine as the state battles a growing number of measles cases. According to the state's Department of Health, 9 new cases of measles were reported between Friday and Tuesday, bringing the total number of cases in South Carolina this year to 138. As a result, 168 people in the state are under quarantine and 1 person is in isolation. The majority of cases reported involve unvaccinated children. In a press conference this afternoon, state officials highlighted the importance of vaccination in stopping the outbreak.
94% are unvaccinated. And so this speaks to the protection that vaccination brings as being the best way to protect people against measles, to prevent ongoing spread and stop this outbreak.
There have been nearly 2,000 measles cases reported across the country this year, according to the Centers for Disease Control and Prevention. All but 8 states have been affected. Measles was declared eliminated in the U.S. 25 years ago by the World Health Organization. But now, health experts warn that with the growing number of cases, the U.S. is at risk of losing that elimination status. Dr. William Schaffner joins me now. He's a professor of infectious disease at Vanderbilt Medical Center and has served as a liaison to the CDC's Advisory Committee on Immunization Practices. Doctor, good to see you again. How big of a concern is it from a public health standpoint that more people are willing to go unvaccinated? And is there any evidence to suggest these vaccines aren't safe?
Well, of course, Lindsay, it's a matter of great public health concern and clinical concern to individual patients that so many parents are withholding their children from vaccination. This is a very serious disease. We should not think it's trivial. For example, before we had vaccine available in this country, back in the 1960s, 400 to 500 children died each year in the United States of measles and its complications. This is a very nasty virus. It's completely preventable. The vaccine is safe, effective. It's been used around the world in many countries, in the millions, if not billions, of doses for the last 50 years. So withholding children from vaccination is a very serious decision. Please, discuss these matters with your own pediatrician and family doctor who's there to care for your children day in and day out.
How much has vaccine hesitancy and shifting policies from Trump administration health officials contributed to this?
Lindsay, I'm sure it's created more confusion, concern, hesitancy. I know my pediatric colleagues are spending more and more time, they and their staff, talking with parents about vaccinations generally, about measles vaccine in particular. We need to provide reassurance so that parents feel comfortable in getting their children vaccinated, knowing it's the best for them, and to create healthier communities. We were down to no children having died in the United States. In fact, we had no cases of measles in the United States. We're turning the clock back to the bad old days, I'm afraid.
Dr. William Schaffner, thank you.